today we're discussing hormonal imbalances and PCOS, polycystic ovarian syndrome.
So the polycystic ovarian syndrome is a very common disorder women experience, which causes majority of the hormonal imbalances we see. So usually this is what the ovary looks like. And the ovary is where the woman's eggs are developing in. So every month you have one egg that develops, and then to the point that it will release. That's what we call ovulation. But when it is developing, it will start off as tiny cysts. Then one of them gets selected as a normal one that will release the egg. In polycystic ovarian syndrome, you have a number of them, all of them developing, and they get arrested during the stage of development. So none of them really gets to be big enough to release the egg.
Oh,
Okay. So then the ovary, when we do the scan, the ovary looks like it has multiple cysts. That's what we call the polycyst.
Okay.
Now, as that is going on, this ovary becomes more enlarged than the normal size. And then the ovary also now produces more of male hormones. The male hormone is what we call the testosterone.
Okay.
So it is the high levels of the testosterone which will now result in the woman developing acne or masculine features. Some develop beard, hair on the chest, hairy arms, hairy legs. And then some severe cases, they have deepening of their voices, okay, because of the hormonal changes. Now, the fact that they don't ovulate, the hormonal changes that should happen after ovulation do not happen. And as a result, some of them do not see their periods.
Yeah.
Okay. So somebody will have this condition and they have irregular menstrual period. The periods can go off 2, 3, 4, 5, 6, up to 1 year. It doesn't come. And some of them, we have to give medications before it comes. Some of the time, it comes back by itself and they tend to bleed excessively until we give medication to stop it. Okay, so that in a nutshell is all polycystic ovarian syndrome does. Now, some people have the polycystic ovarian syndrome, all right, but they still are able to ovulate and get pregnant without problems. When somebody has polycystic ovarian syndrome and they are having irregular periods, it means that they are not ovulating regularly. They are the ones who may develop difficulty conceiving. So then, if they're trying and it's not happening, there is a way we help them to conceive and have their babies. When somebody has polycystic ovarian syndrome and they are obese, it worsens the hormonal imbalance.
Okay.
So for a good chunk of them, once we bring down the weight, the hormones improve, ovulation kicks in, and regular menstruation resumes. Sometimes, if the period does not come, the inside of the womb gets too thick. And if that continues for a long time, we fear that they may develop cancer of the inside of the womb. Wow. Which is why we have to give medication for the flow to come.
Okay.
In the long term, some also are at risk of developing diabetes because of the PCOS. And so when they bring down the weight, that minimizes the risk. Some also have the risk of developing high blood cholesterol levels. Again, which is why we monitor that. If we think the cholesterol levels are going up, we bring it down with medication, encouraging weight management as well. So it's the commonest cause of hormonal imbalance in women. It manifests commonly in the form of irregular menses, weight-related issues, facial hair, and then acne.
Okay.
And sometimes some other skin changes.
Okay. So, for instance, with the acne, is it something that you have to go see the dermatologist, as I was saying earlier in my intro, to get you medications?
Sometimes we manage it together with the dermatologist.
Okay, sure.
Because we give hormonal medication and the dermatologist may also recommend something. The bit about the facial hair, again, sometimes we have to get people to go undertake waxing to remove the hair, or we give medications to suppress the growth of the hair.
Okay.
Because the thing about it is, it gets so severe in some cases that the women get depressed because it's a bit of a stigma, disfiguring you, woman with a lot of hair. There was some time I saw a patient, her hair was more than mine, you know, and that is a big problem. And so in situations like that, we have to use medications to suppress the hair, or let you see the dermatologist, and then we co-manage it.
Okay, so how lifestyle, like, is it something that you're born with, or
Absolutely, yes, you're born with
sure.
it, and so it can manifest at any stage in your life. Some people not earlier on, others later on, others earlier on, others during their adolescent ages, others in their 20s. It can show up at any point in your life. So naturally manage the weight, and we recommend that you should lose between 5 to 10% of your weight. Your hormones will fall in line.
Okay.
Avoid a lot of animal products, regular exercise, okay, and then avoid a lot of processed foods and junk. Keep a healthy weight and a healthy lifestyle. Consume your fruits and vegetables much more than animal products and processed foods and dairy products, because there's also the risk of your cholesterol going high. These are the natural things we recommend. In addition to, if the flows are not coming, then we give medicine to support get a flow to come.
Is this something that can go away after a while? Maybe when you get to your menopause, it stops, or maybe in between, it just, your system just heals automatically.
So when you get to the menopause, then there's nothing about ovulation, menstruation again. So everything stops there.
Okay.
But so long as you are in the reproductive age groups, the symptoms will be there. But when you bring your weight to a good, healthy weight, the hormones do better.
Is there medication to actually help the ovaries, like, stop producing those cysts?
Yeah, that's one of the ways we manage them. We use hormonal pills to make sure those imbalances are restored. And then if they now need to get on to conceive, give medications to make them ovulate so they can conceive.
People with PCOS, do they need medications to increase their eggs, like the quality, to help the quality of their eggs?
Sometimes, yes, because the eggs may tend to suffer some defects in their quality. So there are some supplements we give to improve the quality of the eggs, to minimize the risk of miscarriages when the bad eggs get fertilized. Yeah.
Okay. Please do not forget to subscribe and share this video. You are going a long way to help someone in need. As I said earlier, Dr. Promise Tepoga is with Shape Healthcare Specialist and Medical Center here at Latibiokoshi. He's always available with his team to help you with any issue, any health issue